The first question is enzyme which is going to be active in well-fed state. So well-fed state means the presence of insulin, the glucose and then the presence of insulin. So we have insulin in well-fed state. In fasting state or starvation, we have rather glucagon. So now we'll see which enzyme is going to be active in presence of insulin. And the answer is going to be acetyl-CoA carboxylase enzyme, which is the rate-limiting enzyme for fatty acid synthesis. And we all know that when we eat food, it's a well-fed state, and that time only the liver will be producing the fatty acid from excessive carbohydrate which we consume. So it goes hand in hand. We consume food, we get glucose in the blood, that fetches the insulin into the blood, and that insulin activates the rate-limiting enzyme acetyl-CoA carboxylase, which then starts producing fatty acid, and that fatty acid is packed in the VLDL in the form of triacylglycerol, and this VLDL is secreted from the liver. So this is how the answer will be on option C. All of these statements are wrong. Pyruvate carboxylase is a gluconeogenic enzyme which is going to be active in lack of insulin. HMG-CoE lyase enzyme is going to be a ketogenic enzyme which again is going to be more active in fasting and starvation state. When we talk about CPT1, carnitine palmitoyl transferase 1, it's a transporter which is having the role to enhance the fatty acid oxidation, which again is going to be more active in lack of insulin. So the answer of this question, where the enzyme which is going to be active in well-fed state will be acetyl-CoA carboxylase, which is rate-limiting enzyme of fatty acid synthesis. And as far as this enzyme is concerned, you should know that it's not mere presence of insulin which is important for action of this enzyme. We also need to have citrate in the cytosol, which will act as a positive allosteric modifier for this enzyme. So there are two things. Number one, the insulin which is making the enzyme dephosphorylated, which is the active form of this polypeptide. And number two, the citrate which is going to act as a positive allosteric modifier which is needed for action of this enzyme. Now coming to second question. The second messenger for smooth muscle relaxation is mediated by nitric oxide. The second messenger for this action where the nitric oxide is going to do the relaxation of smooth muscle is cyclic GMP. Like for example, when you talk about this particular cell which is endothelial cell, and this is underlying a smooth muscle cell, the nitric oxide is produced in the endothelial cell by action of nitric oxide synthase enzyme on arginine, which is going to produce nitric oxide with the byproduct formation citrulline, right? So we have arginine, which is going to get acted upon by NOS enzyme, that is nitric oxide synthase enzyme, that's going to produce you nitric oxide and citrulline. And this nitric oxide is having paracrine role to play. It's not autocrine. I mean, the cell which is producing nitric oxide is not going to have its effect. Rather, the adjacent cell is going to have the effect of nitric oxide. So it's having the paracrine role to play. So this nitric oxide diffuses into underlying smooth muscle, and there it's going to activate cyclic GMP dependent protein kinase enzyme. How? Because this nitric oxide, first of all, it's going to activate within the cell itself. It's going to activate the guanylyl cyclase enzyme, which is just like adenylyl cyclase, which is converting GTP to cyclic GMP. And when cyclic GMP is formed, this cyclic GMP is going to activate cyclic GMP dependent protein kinase enzyme. So this is all a question to you that how this nitric oxide is going to act. So your answer should be, in our endothelial cell it is getting produced, but it's underlying a smooth muscle cell where it is going to act. And this nitric oxide, by activating this guanylyl cyclase, produces a lot of cyclic GMP, which is going to activate the cyclic GMP dependent protein kinase enzyme. And once activated, multiple number of proteins, they undergo phosphorylation, and that results in vasodilatation, smooth muscle relaxation. So the answer, it's an old question and a very important question. So you should know it is cyclic GMP. Now coming to third question, which is talking to you about 10-year-old boy presenting with abdominal pain and muscle weakness, fatigue. Serum lead was increased and activity of which of the following liver enzyme is increased? So lead poisoning. Lead poisoning is going to have its major impact on heme biosynthesis, where it is going to inhibit one enzyme which is called ALA dehydratase. ALA dehydratase is a cytosolic enzyme of heme biosynthesis which is going to convert the ALA to PBG. So the lead is going to inhibit this enzyme. So if they ask you which enzyme is inhibited in presence of lead, your answer should be ALA dehydratase. But this question is not asking you about the enzyme which is inhibited, rather it is asking you which enzyme is rather increased in lead poisoning. So let's see what is the answer. Answer is going to be ALA synthase enzyme. This enzyme activity is seen to be increased in lead poisoning. I'll explain you how. See, when ALA dehydratase is inhibited by lead, the level of intermediate ALA is going to enhance. This will go and get accumulated because it's not going to get converted to PBG. And of course, the further pathway is impeded and heme biosynthesis is badly affected. That is the reason of lead-induced anemia. That's the reason of lead-induced anemia. The child who is presenting with lead toxicity is often presenting with anemia, along with other symptoms which are given in the cases, this particular case, the abdominal pain, the neurovisceral finding. Now, if I tell you in simple word, the heme synthesis regulation, you have rate limiting enzyme ALA synthase, which converts succinyl-CoA and glycine, which are the substrate of heme biosynthesis, to ALA. And this ALA is then converted to PBG, then in multiple steps, finally it is converted to heme. I just want to tell you that this heme, which is normally produced in the cell in a normal healthy baby, is having repression effect on the gene of ALA synthase. Gene of, not directly on the ALA synthase as such. The major impact of this heme is on the gene of ALA synthase, which it is going to repress. So when there is heme, there is repression of ALA synthase. And in lead poisoning, what you are seeing? Lead poisoning, you are seeing that there is no heme. In lead poisoning, there is no heme. So there is no repression. When there is no repression of the gene, gene is expressed. And when the gene is expressed, the amount of enzyme will be more. When amount of enzyme will be more, the number of units are more, the overall activity of the enzyme will be more. So in lead poisoning, now we get two important points. The enzyme which is inhibited is ALA dehydratase, which impairs the heme synthesis, and heme is not produced and ALA is accumulated. And in addition to that, because of lack of heme in lead poisoning, there is de-repression of the gene of ALA synthase that results in activation of gene of ALA synthase, and that starts producing a lot of ALA synthase units. And when the number of enzymes are increased, the overall activity is going to enhance. So which enzyme activity is enhanced? You have to say ALA synthase activity is going to enhance in lead poisoning. All right. And it is not only one enzyme which is inhibited by lead. One I have told you is ALA dehydratase. Another to note is ferrochelatase. Ferrochelatase, which is chelating the iron in the protoporphyrin 9 ring in the final step of the heme biosynthesis. That also is inhibited by lead poisoning. So this also at times they ask you that which two enzymes are getting getting inhibited in lead poisoning. So you have to say ALA dehydratase and ferrochelatase. Now coming to next question, that is talking to you about avidin. Avidin, it's found in egg. It's a protein. It is not enzyme, it's just a protein. It's just a protein which is found in albumin of the egg. A for A. Albumin is having avidin. If you consume egg, you know the outer white portion is the albumin, and that albumin is having the avidin, which is a heat labile protein. If you heat the egg, if you boil the egg, the avidin will be lost. So this is a heat labile protein which is found in the albumin of egg. Now one more thing I tell you, the yolk, the yellow color internal portion of the egg is yolk, and that is having rich amount of the cholesterol, that is why it is yellow in color. It is also having biotin. Biotin is vitamin B7. So the egg is having a rich amount of biotin in the yolk, but you know, when it is a raw egg, the avidin binds with biotin. The avidin is having strong affinity to biotin. One avidin binds with 4 molecules of biotin. So you know, this avidin and biotin complex is a huge complex, and if you consume raw egg, which is still having the avidin alive, the huge complex of avidin and biotin is not getting absorbed from the GIT mucosa. And so if a person is consuming raw egg for chronic duration, and they say that around 10 to 20 eggs per day, raw eggs per day, for kind of 3 to 4 months duration, if the person is consuming continuously, the person tend to develop the deficiency of biotin, and that can be explained in this manner, that this avidin is making the huge complex with the biotin, and this kind of complex is not getting absorbed from GIT mucosa. So it's better you boil the egg. You know, so that time what happens, the avidin will be lost. It's a heat labile, so it will be lost, and biotin will be available for absorption. Once they asked a question, which was a beautiful question. They asked that the same question they framed, that a person is consuming raw egg in the hope that he will have good muscle and stamina. So after multiple months or many months of such consumption, which enzyme activity is seen to be affected in this person? So there will be lack of biotin in that person, because that's not getting absorbed. And you should know that biotin is needed for all carboxylase enzyme, whether it is pyruvate carboxylase or acetyl-CoA carboxylase, so that person will show the carboxylase deficiency. So that's called multiple carboxylase deficiency is seen on chronic consumption of raw egg. So raw egg consumption is not advisable. Egg is good, you boil it and you consumed it. Now students at times they ask, what about half boiled? So of course half boiled also the avidin will be lost and the biotin will be available for absorption. So now the answer is very clear. The avidin inactivates which of the following in the egg? And the answer is going to be biotin. It's going to make a huge complex with it, which is not getting absorbed. Biotin is otherwise B7, and you know, the answer will be like this. Now coming to next question, number 5. The question number 5 is talking to you about what is involved in the formation of deoxy-TMP from deoxy-UMP. And the answer is going to be N5N10 methylene tetrahydrofolic acid. This is a very, very important reaction in pyrimidine nucleotide biosynthesis, where deoxy-UMP is converted to TMP. Right? And the difference between uracil and thymine bases is the methyl group. If you somehow donate the methyl group to the uracil, it will get converted to thymine. Now, if they ask you what is the donor of methyl group in this reaction, your answer will be N5N10 methylene tetrahydrofolic acid. So this N5N10 methylene tetrahydrofolic acid donates the methyl group and it's converted to dihydrofolic acid. This reaction is catalyzed by one important enzyme that's called thymidylate synthase. So this thymidylate synthase and this tetrahydrofolic acid, N5N10 methylene tetrahydrofolic acid, and deoxy-UMP, they make a ternary complex. And after that, only this reaction can take place and TMP will be formed. This TMP is important component nucleotide for the DNA. So once the TMP is formed, you can expect the DNA formation. And that is why when the 5-fluorouracil is given, 5-fluorouracil, which is antineoplastic drug, that's going to, get converted to 5-fluoro-deoxy-UMP after its metabolism, right? 5-deoxy-UMP, and this 5'-deoxy-UMP will start making the irreversible complex with thymidylate synthase and the cofactor tetrahydrofolic acid, And this kind of, complex will be irreversible complex. So in presence of 5-fluorouracil, the TMP will not be formed and the DNA will not be formed. That explains the anti-neoplastic role of 5-fluorouracil. In neoplasm, your attempt is to prevent the DNA division in the affected cell, in the malignant cell. So when you give this 5-fluorouracil, that's after metabolism, it's converted to 5-fluorodeoxy-UMP, and this 5-fluorodeoxy-UMP is going to make the irreversible complex with the thymidylate synthase and N5 and 10-methylene tetrahydrofolic acid, and formation of TMP and then DNA is getting affected, and that plays a role as anti-neoplastic drug. So this is the very, very important clinical part of the pyrimidine biosynthesis, which you should know. And to further add on to this knowledge, I would like to tell you something important, that this DHF is converted to THF and this THF is converted to N5 and 10-methylene tetrahydrofolic acid. This is how the recycling of N5 and 10-methylene tetrahydrofolic acid is taking place during normal synthesis of TMP in pyrimidine nucleotide biosynthesis. Now, if you ask me the enzyme which is needed to convert the DHF to THF, it is DHF reductase enzyme. Now, methotrexate is again another anti-neoplastic drug. It's going to inhibit DHF reductase and will reduce the supply of THF. So, when there is no THF, there is no N5 and 10-methylene THF, because we need to have this free THF for availability of this N5 and 10-methylene THF. For this, you should know we have serine metabolism, which is converted to glycine. Serine is converted to glycine, and in this process, the THF is converted to N5 and 10-methylene THF. So now you have to understand the role of methotrexate as an anti-neoplastic drug. The methotrexate is again, affecting this portion of the pyrimidine biosynthesis, where this methotrexate is going to inhibit, I am repeating it, it's going to inhibit the DHF reductase and thus reducing the supply of THF. When THF is not there, you don't have N5 and 10-methylene THF. So there will not be formation of TMP. When there is no TMP available, DNA will not be formed and the dividing cell will not be able to divide. So this is how methotrexate is acting as an anti-neoplastic drug. So all these things you should know. 5-fluorouracil also, and acting as anti-neoplastic drug, but that directly is not going to inhibit the thymidylate synthase. 5-fluorouracil has to have this conversion into 5-fluorodeoxy-UMP, and then the enzyme get confused and it starts binding with this 5-deoxy-UMP and then to this cofactor, making an irreversible complex which is not allowing this reaction to go on. Right? So these points you should know regarding this kind of question. It will give you multiple questions. So this concept is very, very important. I hope it is clear. Now coming to next question. Which of the following is not an antioxidant? So antioxidant is one which is going to handle the free radicals, which is going to neutralize the free radicals, or the one which is going to prevent the occurrence of free radicals, the formation of free radicals. Accordingly, we have preventive antioxidants and we have chain breaking antioxidant. So we have, kind of antioxidants which prevents the formation of free radicals first hand. And on the other hand, we have the antioxidants which are going to act on the available free radicals and kill them so that they do not produce their clones. So they are called chain breaking antioxidants. Now if you see these options, all will act as an antioxidant except iron. Iron is not an antioxidant. Rather they say the iron in the ferrous form is very dangerous and it's going to start the Fenton reaction which is going to generate free radicals from H2O2. So iron is rather a agent which can produce free radical. It's not an antioxidant. Otherwise, if you talk about selenium, it's an important part and parcel of glutathione peroxidase enzyme, which is said to be an important, antioxidant enzyme. Then copper and zinc, they also play antioxidant role. Now, iron, I said, is very dangerous. Ferrous form is going to initiate the Fenton reaction, and that's going to produce free radical. And that is why if you pay little attention to iron metabolism, you'll see that nature has given us the mechanism that no way the free ferrous form is circulated in the plasma. We have the ferric form, and that too bound with apotransferrin, which is going to make you transferrin, and in this fashion only iron is being transported into the plasma. So nature has given the mechanism to avoid the availability of ferrous form in the plasma in best possible ways. So this also is a question to you, that in transferrin, what form of iron is being circulated? So you have to say it is ferric form, 3+ ferric form of iron which is being circulated. Okay, now coming to 7th question. Now, protein is purified using ammonium sulfate. The answer is going to be salting out. Ammonium sulfate is a salt, and this salt is very much hygroscopic. It's having a tendency to absorb water and make the shell of hydration around it, which will make it very soluble. Instantly, as it is dissolved in the solution, the ammonium sulfate will be dissolved easily because it attracts a lot of hydration cell to dissolve itself. So now, for example, suppose if there is a protein which is dissolved in water, so obviously there is a shell of hydration around this protein which is making it soluble, right? And when you add the ammonium sulfate like this, these ammonium sulfate will start dragging the water from around these protein, which will make the ammonium sulfate soluble. At the same time, protein getting precipitated. When the shell of hydration is removed from around the protein will undergo precipitation. So this is a method of protein precipitation which is commonly used in industries, and the ammonium sulfate in good amount is dissolved in solution containing protein. So what happens? The protein undergoes precipitation, ammonium sulfate undergoes, it gets dissolved in the aqueous media, because it attracts or detaches the shell of hydration from around the protein. This is called salting out. You put the salt and proteins are out, right? This is called salting out. Now, how much ammonium sulfate you will be desiring to make the protein precipitated? It depends upon the molecular weight and size of the protein. Like, for example, when you talk about albumin and when you talk about globulin, globulin is a big protein and albumin is a smaller protein. So suppose if you take certain grams of albumin and the same grams of globulin in two different beakers, the same concentration of albumin, and say for example, say 10% of albumin you have taken, and similarly 10% of globulin you have taken into another beaker, the number of molecules will be more in albumin because of its small size. In 10 gram percent solution, more of the albumin will be there, and when you talk about globulin, the amount of globulin will be less. So now, if you see the surface area, it is more for albumin, and surface area, because number of molecules are less in number, the surface area is going to be less for globulin. So when you add the ammonium sulfate, you need to add more ammonium sulfate for precipitating the albumin, and you need to add less ammonium sulfate for precipitating the globulin, because the shell of hydration which need to be detached is dependent upon the surface area. More the surface area, more the shell of hydration, less the surface area, less the shell of hydration. So the globulin is having less shell of hydration, so less amount of ammonium sulfate will be needed to precipitate the globulin, but albumin will be requiring higher amount of the ammonium sulfate. So it is called full precipitation. The albumin is, now this is your MCQ, that albumin will be precipitated in full saturation, and globulin will be precipitated in half saturation by ammonium sulfate. Half saturation. तो ये आपके MCQs होते हैं. तो ये भी, this also you should know that albumin is precipitated by full saturation of ammonium sulfate, and globulin is getting precipitated at half saturation itself because of lesser surface area, less number of molecules, so lesser surface area and less amount of ammonium sulfate than desired. Right. Now, so this is about the method of protein precipitation, and when you are using ammonium sulfate, this process is called salting out. Now coming to next question. Positive signal for glycogen breakdown. Glycogen breakdown means when you are learning in biochemistry, you understand they are talking about glycogen phosphorylase enzyme. Glycogen phosphorylase enzyme. So glycogen phosphorylase is the one which is needed for glycogenolysis. The positive signal for glycogen breakdown in the muscle, not liver, muscle includes increase in all of the following except. Now you see there are a lot of twists in the question. So they're talking about the muscle, they're talking about the glycogenolysis, they're talking about the one which is not the positive signal. So answer is blood glucose. See, the muscle glycogenolysis is not affected by blood glucose level at all. The blood glucose is having its impact on the liver glycogenolysis, because that is going to be the secretor of free glucose to the blood. The blood glucose is having no impact on muscle glycogenolysis, because system knows that muscle glycogen is not meant for blood glucose, for providing the blood glucose. So the blood glucose, whether it is high or low, it's not going to have impact on the muscle glycogenolysis. So the answer is very clear. This is the answer. And as far as cyclic AMP is concerned, epinephrine catecholamine hormones are concerned, and calcium ion is concerned, they all are having positive impact on the glycogen phosphorylase of the muscle. Please understand, the glucagon is having no effect on muscle glycogenolysis, because again the glucagon is a hypoglycemic hormone. As I've told you, the hypoglycemia has got no impact on the muscle glycogenolysis. So God has not given any regulation of the glucagon on the muscle glycogenolysis. See, in the question they're talking about epinephrine. So epinephrine is certainly having the impact on the muscle glycogenolysis, because it's a stress hormone, and during stress, when you want to fight or flight, your epinephrines are secreted, and those epinephrines are going to have the positive impact on the muscle glycogenolysis, so that muscle gets fuel in the form of glucose 6-phosphate, which can enter the glycolysis and provide ATP for fight or flight, right? So epinephrine certainly having a positive impact on the muscle glycogenolysis, but glucose is having no impact, glucagon having no impact, cyclic AMP having impact, calcium ion having impact on muscle glycogen.